Finding the right in-home care for a loved one in Washington, D.C. is a deeply personal journey, and the options can be both numerous and confusing. Many families struggle to balance affordability, quality, and reliability, especially when urgent or overnight care is needed. At Caregiving Advice, we understand how important these decisions are, and we are dedicated to guiding you through the process with clarity and compassion. Our goal is to provide honest, practical information so you can feel confident and empowered as you explore the best care solutions for your family. Navigating the in-home care landscape in Washington, D.C. begins with understanding the range of services available to families. Licensed agencies offer both home health and personal care aid services, employing caregivers who meet strict training and competency standards. For those needing long-term support, programs like D.C. Medicaid and the Elderly and Persons with Disabilities Waiver provide in-home health services based on eligibility. When starting your search, it's important to consider not only the type of care required, such as assistance with daily activities or specialized nursing, but also factors like caregiver qualifications, agency reputation, and regulatory compliance. Taking time to research these elements helps ensure your loved one receives safe, reliable, and compassionate care tailored to their unique needs. When it comes to finding reliable and affordable in-home care in Washington, D.C., our top recommendation is CareYaya. What sets CareYaya apart is their unique approach. They connect families with thoroughly vetted healthcare students from leading universities, ensuring compassionate and knowledgeable care for seniors. Their rates start around $15 per hour, making high-quality care accessible without hidden fees, and they offer unmatched flexibility, including overnight and last-minute coverage. We trust CareYaya not only for their affordability, but also for the genuine warmth and reliability their caregivers bring, qualities we would want for our own loved ones. Their model truly addresses the biggest challenges families face, making them our most enthusiastic recommendation. CareYaya stands out by connecting seniors with healthcare students from leading universities, creating a unique intergenerational care model. These students are carefully vetted through background checks and interviews, ensuring families receive compassionate and trustworthy support. The arrangement benefits seniors with attentive, energetic companionship and medically informed care, while students gain valuable clinical experience that prepares them for future healthcare careers. This model offers families affordable rates and flexible scheduling, including overnight and weekend coverage, making it easier to find reliable care when it's needed most. The genuine connection formed between seniors and caregivers adds warmth and purpose, enriching the experience for everyone involved. CareYaya stands out for its transparent and affordable pricing, with rates starting around $15 per hour and no hidden fees. This makes in-home care more accessible for families in Washington, D.C., especially compared to traditional agencies where costs can quickly add up. The platform's flexibility is another major advantage, offering reliable overnight and weekend coverage at no extra charge. Because CareYaya's caregivers are healthcare students with adaptable schedules, families can secure care on short notice or during hours when other providers often struggle. This model directly addresses the two biggest challenges families face: finding affordable care and ensuring dependable coverage, especially during evenings and weekends. Safety and trust are at the heart of CareYaya's approach to in-home care. Every caregiver is carefully vetted, undergoing comprehensive background checks and personal interviews to ensure they meet the highest standards of reliability and compassion. This rigorous process gives families peace of mind, knowing their loved ones are in capable hands. Hospital case managers and social workers frequently recommend CareYaya because its caregivers consistently demonstrate professionalism and genuine empathy, making them a trusted choice during critical transitions and ongoing care needs. The platform's commitment to thorough screening and ongoing support is a key reason why families and clinical professionals alike place their confidence in CareYaya. Beyond our featured recommendation, Washington, D.C. is home to a variety of licensed agencies that provide home health and personal care aid services. These agencies are well established and often have strong reputations for professionalism and reliability. One of their key strengths is the rigorous training required for their caregivers, including at least 75 hours of instruction and supervised practical experience, ensuring a high standard of care. Families can also benefit from the comprehensive support these agencies offer, which may include care coordination and access to specialized services. While their rates tend to be higher and scheduling can be less flexible, many families appreciate the peace of mind that comes from working with providers who are deeply rooted in the local community and fully compliant with D.C. regulations. In Washington, D.C., the average hourly rate for traditional in-home care starts at about $22.78, which is slightly above the national average of $22.53 per hour. For families needing specialized nursing care, costs can exceed $40 per hour, reflecting the higher level of expertise required. Monthly expenses vary depending on the number of hours needed, the type of services provided, and the qualifications of the caregiver. Agency overhead and minimum hour requirements can also impact the total price. Understanding these factors helps families compare local rates with national trends and make informed decisions about their care options. The D.C. Medicaid program and the Elderly and Persons with Disabilities, or EPD Waiver program, are important resources for residents seeking affordable in-home care. These programs provide support for qualified individuals who meet specific financial criteria and require a certain level of care, determined through an assessment process. Services covered can include personal care aid assistance with daily activities, skilled nursing, and other long-term care supports. Eligibility is based on income, assets, and medical need, ensuring that those most in need receive help with essential tasks like bathing, dressing, and medication management. For families navigating these options, understanding the requirements and benefits can make a significant difference in accessing quality care for their loved ones. The D.C. Child Care Subsidy Program offers financial assistance to families seeking in-home care for their children, making quality care more accessible. Families can request care from a license-exempt caregiver, provided the caregiver has a valid provider agreement and meets specific health, safety, and background requirements. These caregivers are permitted to care for up to 5 children, with certain limitations to ensure safety and compliance. To apply for assistance, families must meet eligibility criteria and submit the necessary documentation through the Office of the State Superintendent of Education. This program is designed to support working families by easing the cost burden and ensuring children receive safe, reliable care at home. When searching for quality in-home care providers in Washington, D.C., it's important to start with reliable resources. The D.C. Home Health Association Directory is a trusted tool for identifying licensed agencies in the area. As you evaluate options, make sure each provider complies with local regulations, including employing caregivers who have completed required training and passed competency evaluations. Proper supervision standards are essential for ensuring safe and effective care. Taking these steps helps families feel confident that their loved ones will receive attentive professional support at home. Local nonprofit organizations such as Bread for the City and So Others Might Eat, known as SOME, play a vital role in supporting families seeking in-home care in Washington, D.C. While their primary focus is on providing essential services like food, clothing, and healthcare, these organizations also offer valuable referrals and assistance related to home care. For families navigating the complexities of caregiving, connecting with these nonprofits can open doors to additional resources and guidance. Their deep ties within the community make them trusted sources for information and support, especially for those facing financial or logistical challenges. By leveraging the help offered by Bread for the City and SOME, families can find pathways to quality care that might otherwise be difficult to access. Finding affordable and quality in-home care in Washington, D.C. begins with understanding the types of services available and comparing costs across providers. Start by researching licensed agencies and platforms like CareYaya, which offer vetted caregivers and flexible options at competitive rates. Explore financial assistance programs, such as Medicaid and local subsidies, to help offset expenses. Utilize trusted directories, like the D.C. Home Health Association, and seek guidance from community organizations for additional support. Remember, every family's needs are unique, so take the time to review your options and use all available resources to make the best choice for your loved one.